MITRE offers employees two health plan options, the FlexCare PPO or the HD Care PPO. But sometimes it's hard to know which choice is best for you and your family. You need to carefully consider each option to determine the best fit for your family's needs. To get you started, let's look at both plans. Let's start with what's the same in each plan. Both plans are national PPO plans. PPO plans are preferred provider organizations and give you the freedom to choose whichever providers or facilities that you like. You do not need to choose a primary care physician, or PCP, and you will not need referrals to see specialists or other doctors. In-network providers will cost less out of pocket, while out-of-network providers will cost more. Both plans cover in-network preventative services at 100%. That means that your annual, routine checkups with your healthcare provider, as well as well-child visits, routine blood work, and routine OB/GYN appointments, among other things, won't cost you anything out of pocket. And finally, both plans have deductibles. The FlexCare PPO offers a lower deductible than the HD Care PPO, but also has higher premiums. Both offer the ability to pay for deductible expenses and other out-of-pocket costs using a tax-advantaged account, such as a flexible spending account, FSA, or health savings account, HSA. You are not taxed on your contributions to these accounts. Now let's check out some of the differences between the two plans. The FlexCare PPO has a lower deductible than the HD Care PPO, but you may also pay a higher premium. Additionally, some services, like doctor's office visits and ER visits, are not subject to the deductible. Instead, a copayment applies for these services. Prescription drugs are also not subject to the deductibles. Again, copays apply. Once the deductible is reached, services that apply to the deductible are covered at 100%. Under the HD Care PPO, the premium is lower, but you will also have a higher deductible. Additionally, more services are subject to the deductible, including non-routine doctor's office visits, emergency room visits, inpatient and outpatient services, and most prescription drugs. Prescription drugs that are preventative, however, are not subject to the deductible. There is an additional difference in how the deductibles work if you have more than one person on your plan, like a spouse or children. In the FlexCare PPO, your deductible contains two components, an individual deductible and a family deductible. Having two components allows each member of your family the opportunity to have your insurance policy cover their medical bills prior to the entire dollar amount for the family deductible being met. For example, if your spouse meets his individual deductible of $500, the deductible will no longer apply to him even if the full family deductible of $1,000 hasn't been met. For the HD Care PPO, all services will continue to apply to the deductible until the entire family deductible is met. You must reach the full family deductible amount before anyone's services will be covered. While both plans allow you to leverage tax-advantaged accounts, there are some differences in which types you can utilize. For the FlexCare PPO, you can choose to enroll in a flexible spending account, FSA. For the HD Care PPO, you will be enrolled in a health savings account, HSA. Both FSAs and HSAs allow you to take advantage of pre-tax contributions taken directly from your paycheck, and both can be used to pay for deductibles and other out-of-pocket costs. The HSA, however, is yours to keep, regardless of whether you change employers or leave your job. It also accumulates yearly. Any funds you don't use remain in your account, and MITRE contributes up to $600 to your HSA for individual coverage and $1,200 for employee plus one and family coverage annually. In summary, MITRE's healthcare plans each offer some unique advantages. Every employee must decide which option works best for them. For more details on each plan, as well as resources to help you decide which plan is right for you, please visit FastJump 2018 Healthcare.